Good morning, everybody. So I'm going to talk about artificial intelligence in ophthalmology. I hope all of you know a basic understanding of what is artificial intelligence. Let's go over the definitions once. Artificial intelligence is the entire branch that is dealing with the simulation of intelligent behavior in computers. It can be machine learning or it can be programmed, but it simulates human behavior, simulates human intelligence. Machine learning is specifically that type of artificial intelligence which deals with the machine learning by itself. That is like a baby. If you have a baby, you don't specifically have to make the baby sit in a class and teach, okay, this is how to crawl, this is how to stand up, this is how to walk. The baby learns by trial and error. That is how machine learning works. Deep learning, I'm sorry, can I go back one slide? Yeah. So deep learning, it is inspired by the neurons of the human brain. It uses a lot of data and it learns absolutely by trial and error. You don't tell it what the rules are. You just let it do something, then you say, no, this is wrong, don't do this, do it some other way. And then it learns again, and that is how deep learning works. Neural networks simulate the human neurons in that these things are all similar nodes which get inputs from various factors. For example, if you are doing a neural network for IOL power calculation, you give it all these numbers and tell it this is the expected answer, and then you give it another set of numbers, tell it this is the expected answer. You don't tell it how to calculate it, you don't tell it the formulas already in existence. It figures out on its own. So that is the entirety of artificial intelligence which you should know at least now. So where are we now? We are in the fourth industrial revolution. First, second, third industrial revolution is over. We are in the fourth industrial revolution, which is artificial intelligence and other cyber physical systems. This is the entire pathway, the main highlights. And we are in the age of artificial intelligence. All these things which you see here, which you never thought of, are all using artificial intelligence. These things you may not have seen, but if you go and search for Boston Dynamics on YouTube or Google, you will see these machines which were, when they first started, they were very clumsy, but now they are completely autonomous. Machine learning in medicine is going to improve the accuracy and quality of medical care. And the big companies know that. Google, IBM, Microsoft all have their hands in the machine learning pie. And ophthalmology is not the only branch. All the other branches of medicine are in on this. But ophthalmology has a lot of data to analyze, so we have to be there at the forefront. All these, diabetic retinopathy, glaucoma, to squint, ocular cancers, all these are using artificial intelligence in some way or the other. IOL power calculation, planning of surgeries including squint and intravitreal injections are using artificial intelligence now. You can detect from fundus photographs these things. Did you even think that you could detect cognitive impairment or Alzheimer's disease or risk of stroke? You can predict when you will die. Take a fundus photograph and the computer says you will die in 5 years. That is the possible future. In fact, that is already there. It will not tell you will die. It will tell you have a risk of 70% risk of death in 5 years from cardiovascular risk. So that is exactly the same thing. The Facebook quizzes which you see, they are real now. Diabetic retinopathy, lots of stuff, lots of companies, lots of software. Glaucoma, OCT segmentation of the disc is already there in all the machines. Sensimet triggerfish, they wanted to try continuous IOP measurements. They did not know what to measure, so they put the data collected from the corneal curvature change into the machine learning network, and it figured out at this particular parameter, this is the IOP. So the next time similar parameters come, it will tell, okay, this is the IOP which is there according to previous data. And anterior segment OCT, fundus, of course you can find the cupping, OCT for RNFL GCL, but this is not all. You have visual fields. So once you have visual fields, you can automatically pass the Anderson criteria. That is very simple. It can differentiate glaucomatous visual fields from normal. It can analyze the visual field defects. We can analyze the frequency doubling petri, which nobody here knows to read, I suppose, including myself. So progression of patterns of the fields, all these will become very simple. You don't have to look at the paper and think what you studied 5 years back. You can just let the machine tell you what to look for. That is not all. They trained a deep learning network and it can predict the future. Give the visual fields today and tell this is the IOP, this is the age, and other parameters of the patient which comes from the electronic medical records, and it will tell 10 saal baad, this is your field. If the IOP is at a particular level, if the IOP is at another level, this is your expected field. So you can predict, you can tell the patient, see, this is what you have now. If you keep your IOP at this level, that is, if you use a medicine which I give you, this is what will happen. Patient can understand what is going to happen. This is already there. ROP, there are quite a few tools. These 4 are the main tools for ROP analysis. ARMD, from fundus photos, from OCT, it can predict the visual acuity. You take a fundus photo, you forgot to take the patient's visual acuity, the software will tell you, from the fundus photo, the visual acuity is 6/36. And you can predict how much anti-VEGF is. The patient will ask you, you're telling me you need a few injections. Few means how many? 5, 10? You tell the machine says you will need 5 injections. Retinal vascular occlusions, you can detect all these things from fundus photos. It can quantify macular edema from OCT, we can also do that. But can you predict macular edema from a fundus photo? That is, the thickness of macular edema can be predicted from a fundus photo because the data was given to the machine. This is a fundus photo of a thickness of 300 and this thing. This is a fundus photo of 400. So from this photo, tell me what is the macular edema thickness in the OCT. So you don't have an OCT, you can take a smartphone fundus photo and get the OCT thickness value. Segmentation of the OCT, ERM, DR, ARMD, you can predict the perimetry from the OCT. You can detect other retinal diseases also, retinal detachment, very easy for us, little difficult for the computer. Keratoconus, you can identify from the Placido topography or Schleimpflug or Pentacam. So let me wind up with the other corneal diseases. Cataract grading, you can do from slit lamp, from ultrasound, from fundus photos. Fundus photo, cataract grading. Predict PCO risk. Pediatric ophthalmology, there are lots of things, including if you just go through Facebook, let the algorithm go through Facebook, you can identify potential, that is, you can identify leukocoria. You can demarcate ocular squamous cell neoplasia from unstained specimens. You can predict progression of refractive error and so on. So why is AI going to change the world? Lots of things. Doctor shortage is one of the most important. So thank you. I have an article on role of artificial intelligence. So if you want to look at more of these things, you can look at this article.
But
I have some 140 references on there, so you can go through all the references.
But beautifully summarized.